My name is Lynette. I have been working as a behavioral specialist with youth ages 12 to 18 for the past 2 years. Anxiety, you can tell that your child has anxiety in a lot of different ways. Kids will present in a lot of different ways. Most often it's worrying, where they're just worrying about, well, what if this and what if that and what if this, and working through the scenarios of what might happen. They may start withdrawing from things that they used to love to do because they're so worried about the what ifs. They may start lashing out because they are feeling so insecure. They don't want anyone to notice, so they want to put attention someplace else. And if they're lashing out about this thing over here, then you're not going to notice that they're feeling worried, that they're feeling upset. Things that we have seen work really, really well. Oftentimes, if you can slow things down and identify with the youth or the child that what they're doing. Hey, I just noticed that you're pulling back from that. Can you talk to me about what's going on? And if you can get them out of the anxiety wheel, that starts to help. There are some anti-anxiety meds that even in a low dose for a short amount of time can help them, because a lot of times anxiety is because the serotonin levels are low in your brain. And if the serotonin levels are low, the lower the serotonin levels, the less your brain works to create serotonin, which helps us solve problems, which helps us see solutions, which helps us get out of those things. So if you can get the kid to calm down, to take a deep breath, and to allow themselves time, then they can, whether you do that behaviorally or whether you go with a low dose of something that helps their brain to start producing it. And then sometimes you can take them off the medicine, but because you've been working with helping them identify right away when they start feeling anxious, that then they start being able to do it on their own. And then their brain, because it started producing more serotonin, will produce, and then they'll be able to solve those on their own, and you won't find yourself dealing with the reactive behaviors that come along with anxiety. I think the biggest thing that a parent can do to help a child with anxiety is to control their own anxiety. So when you see your child, or you see your child doing the reactive things, if you can make sure to stay calm and then effectively communicate with them, to identify for them, because a lot of times a kid, especially in teenage brain with all the hormones and things they've got going on, they won't recognize. They don't know that they're doing something that's irrational, or that they're doing something that's outside of the normal. For a parent who is thinking that their child has anxiety, to step back and to say, take your own deep breath before you start to go and say, okay, so this is what I see, and help them to try and get outside themselves, because a lot of times anxiety is just them closing in on themselves. But to help them step out of themselves and open back up will open pathways and doorways in their brain that they wouldn't have known were options before. The SOTAs process is really, really fantastic. It helps them identify a situation and then lets them see that they have options, and then you build off the options. Okay, great. See that option. That is not an option I would choose, but it's an option. What would be the benefits and what would be the detriments of doing that? And then move through each of those options, because a lot of times when they've closed off, they're only going to do the one thing that they know how to do. And they get very, very stuck in survive. I've just got to survive. I've just got to survive. And really, they don't have to just survive. They can live. But not if you don't help them build off of all of the different options and communicate with them. So whether they're yelling at you, screaming at you, throwing things at you, if you're seeing those kinds of reactive behavior, or withdrawing and shutting you out completely, if you can calm yourself down enough to go and talk to them and communicate with them and help them see that there's another way. There's other things that can get them through what they're struggling with, that oftentimes then the child will start working through on their own, and you don't have to oversee that as much.